Things like having healthy limits to things. Don't cut out all the good stuff that brings you joy, just having a healthy limit. If you like cookies, or if your vice is maybe chips, set aside a serving of chips, and then just eat those and put the bag away.
Welcome back to Inspire Great Health. Today I have Bree Bailey, and we're going to be talking about preventive care. Welcome, Bree. I'm so excited to have you on the podcast today.
Thank you for having me.
So let's talk about preventive care. Well, first, let's talk about you and why you're an expert in preventive care. Tell me a little bit about yourself.
So I am the CRMG Clinical Specialty Program Manager. So I help with a lot of the quality type things throughout the organization and throughout our clinics. So all of Cheyenne Regional Medical Group, I help assist them, just trying to do the things that are the best for our patients. And then also trying to make sure that we are the most efficient so that we can manage those bigger populations of patients.
And you deal a lot with preventive care.
I do.
What is preventive care?
So preventive care is really when you go to your provider's office or finding a problem before it's an actual big problem. So things that we do with screenings, whether it's depression screenings or whether it's mammograms, colonoscopies, screening for cancers, those kinds of things. That's really a lot of what preventive care is. In addition to that, we also screen and check blood pressures because typically most patients don't know that they have high blood pressure until they come to the office, and then we've screened them, we've seen them several times, and then they end up having high blood pressure. We want to treat that as early as possible. So we do those with screenings and preventive care.
So it's empowering the patients to take their health back into their own hands, and obviously we're there to help them through it, but we want them to take their health into their own hands and advocate for themselves.
Yes. Yep. It's really the patients and families switching more of a proactive approach. So a lot of times we're very reactive. Just generally in healthcare, when you go to the hospital or when you go to the urgent cares, even the ED, we typically have a big problem, and that's why we're going there. And that's very detrimental to patients. And so when we don't do the screenings and when we don't do regular follow-ups, it's hard for us to stay on top of those conditions. And then at that point, you're in crisis. And so then it's all very reactive. And now we're telling you, hey, we have to do all this stuff. Whereas if we maybe screen for that beforehand, we would hopefully avoid some of those things and hopefully less of that stress that we're putting on you and the families. Hey, now I can't work, those kinds of things.
What's the difference between preventive care and routine care?
So typically preventive care is really that proactive approach. We're looking and screening for things before they're actually diagnosed or a problem. Routine care is typically where you'll set up times and regular appointments with your provider to go in and get seen. So if you already have those conditions, we already saw you at a preventive visit, you do have high blood pressure, so now we need to set routine care so that we stay on top of that. And so hopefully it causes less problems down the road for you. It can depend from some people with diabetes, we're going to follow up with you every 3 months. If you are very well controlled and you're on minimal medications or you're even diet controlled, we honestly may just only see you once or twice a year. It really just depends. And that's what we have you work with your primary care providers and then even your specialists to decide on what frequency we should see you.
So the two do coincide or can coincide.
Mm-hmm. Yep. We do often try to delineate between the two because often when we're seeing patients or people for multiple chronic conditions, it can become a lot in that visit. And we also want to understand that all of our patients and families, they're not all healthcare providers. Mm-hmm. And so they may not understand or be able to process all the information and education that we're throwing at them. And so we really like to try to delineate between those two things. If we can have a separate annual physical, which is that preventive type visit, and then have our routine follow-ups for like your diabetes, your high blood pressure, those kinds of things. It really helps us provide that holistic care for you.
And can you elaborate on what holistic care is?
So really that's all-inclusive care. That's taking care of you as the patient. So identifying all of those different needs that you may have from social, from environmental, from family, support systems, just making sure that we're meeting you in the middle. That's really how I would explain it. Some people have other interpretations, but that's what I like to think of it as, is that all-inclusive. What can we do for you as the patient?
Is preventive care important even when someone still feels healthy?
Yes, I would say 100%. And the reason being is because, again, we're screening for those problems that we may identify in the future. And if we catch them early enough, or before symptoms even occur, then we can mitigate, or we can really treat those before they become a big problem. Sometimes it's as simple as cancer, which I don't know that cancer is really simple, but sometimes it's catching that early, and then you may not need a surgery. You can have a procedure instead, or you can take a medication as opposed to needing a lot of procedures and surgeries that cause some long-term side effects and stuff like that. And so a lot of times we are all busy and we're all tired, and so a lot of times we'll write off some of those symptoms, and maybe it's not as simple as, oh, this is just how I've always been. And so it's important to bring those kinds of things up so that way we can put it together with the whole picture we're getting in the visit.
So keeping in that same vein, how often should adults or even children have preventive care screenings?
So really, we should be doing it annually once we get out of, so in childhood years and in newborn, all the way through even I'd say kindergarten, we're really good at having those regular follow-ups. And so typically what we'll do is we'll have child checks, newborn check, 2-week check, then 2-month, 4-month, 6 months, so on and so forth, all the way through their 18-month. And then at that point, we go to their annual. So they'll do their 2-year visit, and then the 3-year visit, the 4-year visit, and then their kindergarten. Once we get past that stage, we do see where some patients and families tend to kind of drop off of that, because at that point, we've already gotten their vaccines done. We've done a lot of those developmental screenings, but we really should stay on track with that. So once you get past kindergarten year, we really should stick with annually. We do see kind of an uptick once kids get into junior high school years, because then they need the sports physicals. But we do see that a lot of people, it's more convenient to do just sports physicals as opposed to a well child check. We can bundle those two, the sports physical and well child check, in the same visit. But the problem with that is if we're just doing a sports physical, we don't always see that the screenings are done for the mental health. So depression and anxiety screenings, checking to see developmentally, are they still following suit? And so we really should stick with those even once you get past that junior high age. As adults, once you hit 18, again, we really start to see that decrease. Some of that's because patients are super busy with, they're busy with work, they're busy with college, and that's just a whole different stage in their life that I don't know that anything can really prepare you for. And then as you get older, you start to have a family, those kinds of things. And so then we tend to put ourselves on the back burner.
Because those kids, their kids take the front.
Yes. And so really annually, we still should be screening. Once you get to 40, so we start recommending different screenings depending on your age and your gender. So for women, it's 40, you start getting mammograms is what we recommend. And those are for breast cancer screenings. At the age of 45, there's several recommendations that say we should start colonoscopies or colorectal cancer screenings at 45 now, because we are finding colon cancer at younger ages. But if we're not doing those annual physicals, we don't necessarily know that those are the next things we need to start checking with. Once you hit 65 or Medicare age, or even once you get enrolled with Medicare, we start recommending doing Medicare wellness visits. And so typically what we do at those visits is we're doing fall risk screenings, we're doing cognitive screenings, because as we age, our memory can definitely start to go. And so we start screening for those kinds of things. We start screening for, are you still able to take care of all of your normal things that you were able to do when you were in your 30s, 40s, 50s? Maybe at 60, 65, 70, you're having problems driving to appointments, you're getting lost. You may not be able to afford housing, or you may not be able to afford food. So at those Medicare wellness visits, we really screen for those kind of things. And then in the clinics, we have a lot of resources that we can offer to those patients where we do see issues. The other things that we typically recommend is talking about advanced care planning. So basically, like if you're ever in a situation where you don't want to preserve life, like if you're going to be on a ventilator, or if you want to make sure this person's going to make your decisions and it's maybe not your spouse or your parents, then it's good for us to have those discussions early on, because there's really never a good time to have those. So at those physicals, at annual wellness visits, that gives us that dedicated time where we remember and where we can focus on those things as opposed to all the chronic conditions.
Which preventive screenings are most important at different junctures of life? I imagine that list is quite long, so you don't have to go into extreme detail, but what are just some highlights?
So once you get to the age of 40 as a woman, you should be getting breast cancer screenings. If you opt to not do mammograms, then we can talk about, should we do breast exams, or what are the risks and what are the pros and cons to maybe not doing those annually, since the recommendations are biannually, so every other year. For all genders over the age of 45, we recommend a colorectal cancer screening. So depending on your family and medical history, your own personal history, things that can affect what type of screening we do. So some people opt to do, they're like, nope, I don't want to do a colonoscopy. And so sometimes if you're low enough risk, we could potentially offer Cologuard, which is a kit that comes in the mail. But typically we recommend that about age 45. For kids and for all ages, we recommend vaccines. Those are extremely important. Then even mental health screenings that we do at all of our annual physicals, that's for all ages once you're even into like the school age years now. But typically we start screening for mental health at the age of 12. And like I said, sometimes a little bit sooner. It just really goes off of what we see in those visits when we're seeing patients and kids. I would say once you get over 21, cervical cancer screenings, that's when we start doing those, and that's usually a pap smear. And so we talk with patients about what are their risk factors. Is this something that we should be doing? A lot of patients, just because nobody likes those type of visits, it's hard to get the compliance with those. And so really we work with the patients to see, hey, what's going to work for you? And are you low enough for us to do some of those less invasive testing type things?
Are there screenings that you find are typically overlooked?
Yeah, so there are a lot of screenings, unfortunately. So some of the big ones are as simple as dental and vision screenings. A lot of people, they're like, well, I don't have a problem, so they don't end up going. And then again, we go when we have a problem. We have tooth problems, or we're like, hey, now our vision's blurry. Some of those annual physicals or annual care visits, we would be asking, are there any changes in vision? And so in those kinds of cases, sometimes that can clue us into diabetes. Mm-hmm. And so there are different things that our eye doctors can see in the eyes that help us know, hey, something else is going on. If you have high blood pressure, you see changes in your eyes. If you have diabetes, that even if they're not diagnosed, they can see those changes in the eyes. And so we all really work as a team to take care of patients and everyone. And so I would say those are big ones. I would say vaccines. I would say sleep screenings and discussions around sleep. Unfortunately, fatigue is very, very vague. But there's a certain level of like normal tired, and people can chalk it up to normal. Oh, I've always been tired. But there's additional things that we should be looking into on like, why are you tired? Mm-hmm. Sometimes it can indicate heart issues. Sometimes it can indicate sleep apnea. And we tend to find sleep apnea later in life because nobody really wants to wear a CPAP or anything. And so it's good for us to ask those questions and at least get the ball rolling on some of those things before they do become a big issue. There are a lot of times that patients, and myself included, if I don't set up that appointment, I'm less likely to do it. So even just starting with, hey, I'm going to set up my appointment, and then making that plan around that. So if it's when the kids are at school, if it's when you're maybe on a lunch, if it's checking with your work to see, hey, what do you guys cover to let me out of work so that I can go get these things. A lot of insurances, part of their plan is to do those annual screenings or those annual visits. And so a lot of companies are starting to look towards that type of coverage so that they can make sure that you have that time off. And they're even incentivizing some of those things. So honestly, I would say that's probably the biggest one, is really just getting prepared and just making a plan to, hey, I'm going to carve this time out to take care of me. The other things, as you always hear on TV or even when you go to the doctor, if you do, things like having healthy limits to things. Don't cut out all the good stuff that brings you joy, just having a healthy limit. If you like cookies, or if your vice is maybe chips, set aside a serving of chips and then just eat those and put the bag away. If I get a bag of chips, I'm probably going to eat half of that bag. And so in healthcare, we know that there's realistic goals and there's realistic things, and we're all human. So we don't want to take away all the good stuff. Sometimes if it's a new diagnosis, we have to be a little more stringent and strict, and we're going to educate a lot more around that. But honestly, just small changes, those tend to last and be just a little bit more attainable and sustainable.
Let's say someone is just now taking their health seriously. What are some small steps that they can take to implement that healthier lifestyle?
So some of those things, if some of the patients or some people are wanting to lose weight, just making small goals towards that. So again, like if they're like, nope, I always have to have a sweet after dinner, then maybe just having either a healthier choice or option. So have some of those lower calorie or the reduced fat type snacks around the house. If it's really just a matter of scheduling that time to set aside for themselves, just getting it on the schedule and setting a reminder in your phone. Those kinds of things I think are definitely like the most helpful. That's where I've seen several of my patients make changes towards, is just with those small things. If it's weight loss, because unfortunately a lot of people are looking towards that, but then they see it as just an unattainable goal, sometimes even calorie tracking, because you don't realize how much you're putting in. So not only food, but oral things. So like, are you drinking or eating? Or are you drinking calories instead of just eating them? So like, are you drinking a coffee from Dutch Brothers or something like that? Those have a lot of, we call them empty calories. And so just having like a healthy limit towards those kinds of things definitely help. Again, just being realistic with those things. Some people can really dive in and say, nope, I'm cutting everything out. But if you think about it to what you've tried in the past, even to now, if that hasn't stuck with you, then typically it's because we're really strict on those things, and then it's just not sustainable. And so the other thing I like to recommend is changing from thinking of things as like a diet. Oh, I'm on this diet, or oh, I'm doing this for my weight loss or for my health or whatnot. Changing it to thinking about it more of a lifestyle change, that helps just take away that negative connotation to diet.
Changing that wording from diet to lifestyle, that can make all the difference.
That can make a big difference, yes.
What are some realistic goals patients can set to help improve their health?
One of the things I would recommend is coming kind of prepared for your visit, or even if you don't know what to expect for your visit. So say you're 19 and your mom has done all the things for you up until this point. And so now you're starting your adult journey, and hey, I have to call the clinic. I don't have a problem, but I was told I need to do this. So just coming prepared and getting as much information. So sometimes that's as simple as looking online for even like a checklist. What should I ask about at this visit?
Are you accepting new patients?
So I don't typically see patients regularly. I see patients more of a as needed basis. Like say we have some shortages in the clinic because providers are out of the office. So I work alongside with the primary care providers in Cheyenne Regional Medical Group. So that would be Family First, Cheyenne Family Medicine, and then Plaza Primary Care and Internal Medicine. And all 4 of our clinics are taking new patients. All you need to do is either log on to my chart and you can go to visits, and then you'll just select if you're looking to schedule a visit for, say you have a problem, if you're sick, if you're looking to establish care. You can also call the clinic and then just follow the prompts on the phone, and then it'll either get you to one of our shared schedulers to get you on the schedule, or they'll say, hey, you can get in with this provider or whatnot.
Well, thank you so much, Bree. Those are all the questions I have for you. Is there anything else that you'd like to add?
No, I don't think so, but thank you for having me. It was great to be on, and I'm always happy to answer questions. If you have any questions about just starting that first step, then you can always set up an appointment just to talk with a provider. And then, like I said, just get your foot in the door. And I feel like that's the best and first step that you can take just to help be more proactive in your care.
Thank you so much. Today was very informative, and I hope our viewers learned a lot as well. So thank you so much.
Thank you again.
And thank you for tuning in, and please be proactive in your care, and we will see you next time.